I'm delighted to bring to you our next speaker, who many of you will recognize, Alice Hart-Davis. Alice is one of the UK's top beauty journalists. She's an author, a writer, a presenter, and I'm delighted that she has been part of our patient experience and patient education journey for many years now. Alice's experience in journalism goes across and beyond 20 years. She has a vast amount of knowledge and experience, from topicals to technologies to injectables and more. And with that wealth of knowledge and experience, she can capture the evolution of medical aesthetics over this time. Alice is perfectly positioned to bring to you everything that you need to know and to question about medical aesthetics and to demystify the treatments on offer throughout the UK and worldwide. So now I present to you Alice Hart-Davis.
Sharina, thank you so much for that lovely introduction and for having me here to talk today. I'm absolutely delighted to be here to talk about Tweakments. It's what I spend my life doing. Is the sound okay? This is sounding a bit buzzy to me. Okay. So, trends in Tweakments. Are there such things? And what do we want now? That's what I'm going to talk about today. So as Sharina was saying, I'm a journalist. I've been writing about beauty and aesthetic medicine for 20 years now. And over that time, I've tried a huge number of procedures in order to report on them, but also because I'm vain and I want to know if they work and to see what they can do to make the skin better. So with all this testing things out, I've acquired a slightly unusual position in the industry of being a professional patient, an expert patient. So I spend a lot of my time interpreting what's going on in the world of medical aesthetics for a consumer audience, but I spend the rest of my time talking back to the doctors and surgeons and brands in this area about what I see going on from my perspective in the middle. So I have become something of a Tweakments specialist over that time by default. And Tweakments, I'll talk a bit more about what they are on the next slide, but you know, they're small things to make you look better. As Sharina was saying, they're not the big procedures that we used to think of. I've done a whole book about them. I've got a website which has an interactive component, so you can go on and discover what kind of procedures might work for particular concerns. And I've also got a register of practitioners whose work I know and trust, and I'm happy to recommend. And my aims with this really are to try and open up the conversation around Tweakments, because even though we're all much more familiar with all these things than we used to be, a lot of people are still very conflicted about even admitting an interest in this area, because there's traditionally been so much stigma and shame around it, though that is changing. And also, like all the good practitioners in this area, I would love to try and move towards better regulation in the whole Tweakments business, because I don't know if you know about this, but it's a very under-regulated area in the UK. Botox is a prescription medicine, so only medical people can get hold of that, doctors, surgeons, dentists, nurses, but fillers and everything else, the rest of us can have a go. We could go to fillerwell.com, buy ourselves some fillers, get some needles, do a 2-day course and start injecting. You or I could do that. That's really terrifying. So this is why I'm keen to push for better regulation in whatever ways are possible. So what Tweakments are? They are minor cosmetic medical procedures. I like to stress the medical bit because Tweakments is a word that sort of softens the whole idea of these procedures, but we should never forget that they are medical at root. So it's really essential they're done by medically qualified people, which often they're not. So it's all the things you'll have heard of, the Botox, the fillers, the skin peels. I've also put a category up here called Facials Plus, which I think are a useful stepping stone between the pampering that you'll get in a beauty salon and the rather more clinical procedures you'd find at an aesthetics clinic. And Facials Plus are the kind of things we have introduced called hydrofacial, which I know is here today. These are treatments which, if you do a course of them, they will give you a much more profound effect and have a genuine effect on your skin health and on the way you look. So they are far more far-reaching than the pampering treatment, but they're not as challenging to embrace as perhaps a proper clinical treatment is. And do we want tweakments? I think increasingly we do, though people don't always admit this even to themselves. And these are a couple of statistics, my favorites from last year. The Mintel ones saying that of the people they surveyed, 43% would be curious to have a non-surgical procedure. That's quite a lot. And the Real Self website, their statistic was even more compelling. 40% of UK adults, they reckon, would be considering a procedure in the next 12 months. I mean, this would be from their own audience, who would be people already looking towards these procedures, but still, that is a lot more than it used to be. So I'm going to kind of scamper through a Tweakments 101. I'm going to talk about types of tweakments and trends in tweakments, because there are such things. It rather depends on what we want. And in order to do that, I'm going to talk a bit about how tweakments have evolved in the UK. Because 30 years ago, I didn't know about it 30 years ago. I was writing features on the Daily Telegraph. But if you had been in the know, if you knew people who worked in hospital dermatology departments, they were using toxins. They were using collagen as an injectable filler. They were using lasers and peels to resurface the skin, although in a rather, what we'd now think of as a heavy-handed or a kind of treatment that would leave you needing a lot of downtime. And 20 years ago, when I started writing about this area, it was suddenly becoming much better known, although in very small circles. I was looking back at my old cuttings books not long ago and was astonished to find a piece from 1999 where I said that all the ladies of Kensington thought as little of booking their Botox appointments as they did of going to the hairdresser, and that they would equally not want to miss a filler jab in the way that they wouldn't want to miss a haircut, and was talking as if it was already completely established. And this was because the Evening Standard, where I was working then, was very keen on all the sort of trendy, being in the know stuff. But still, I was talking about it as if it was run-of-the-mill. And we had got hyaluronic acid fillers, the kind of fillers we're more familiar with today, emerging, and toxins and various other things. But it was still pretty elitist. Over the next 10 years, energy technologies such as radio frequency, very useful for skin tightening, came in. I remember how excited people got in the office at the prospect of being able to shrink wrap their skin, and until they found out quite how hardcore a radio frequency treatment you might need to achieve that kind of effect, depending on how old your skin is. We saw the first thread lifts come in and then after a bit go away again because they weren't very good. Things like microneedling became better known. And because the UK is very lightly regulated, the UK has been an absolute hotbed for the development of so many of these technologies, which has made it all very exciting. And then in the past 10 years, we've just kind of seen more of everything, more treatments, more awareness of them, more availability, more people offering them, though the people offering them often don't have the right training. And so it's really important to seek out a great practitioner. But you all know that because you know that S-Thetics and Sharina are great places to go. So it's just been accelerating. And now we have more energy technologies like plasma skin tightening. We have ultrasound skin tightening. And the way that people prefer to have their treatments done, because as Sharina was saying, the pace of life is so fast, we haven't got the time to have downtime of a week or so. So we want small, layered and combined procedures that will work together for a greater synergistic effect. So we can do small things without looking hugely different, but which add up over time to a lovely result. So what do we want from this plethora of tweakments that are available? And I would say one key denominator is a fresher face, because that's what it adds up to. We don't want to look done. We don't want to look different. We don't want to look like those celebs we saw earlier where something has gone very wrong. And the human eye is always really good at judging this. I think exactly as Sharina said, you look at a face and you think, something is off. Maybe you don't see it in a picture, maybe you only see it when their faces move, but we can tell. So we don't want different, we want to look like our best selves. And I reckon it's this list of things, from the clearer complexion to smoother skin, fewer wrinkles, less sagging, a firmer jawline, and brighter looking eyes is something we often come up with when describing our beauty wants, just because the eye area is the first to show aging, collapsing, tiredness, all those usual things. And I was then going to talk about how you could go about creating these particular wants with Tweakments. I've got skincare on the list because I would always say start with skincare, and people think, well, Tweakments skincare isn't Tweakments, and it's not, but it's the absolute fundamental for greater skin health, building on the treatments you're having to support the growth of collagen and making the skin smoother and all the rest. So for a clearer complexion, what you're really looking at is removing excess pigmentation from the skin. Great skincare like IS Clinical, or Is Clinical, as we call it, is a very good place to start. Then you can have the kind of facials that fall into my Facials Plus category, like the Fire and Ice treatment, where you have one peel, one mask that's a peeling treatment, and that will help with the skin clearing, and then you have the cooling element afterwards. It's not as challenging as the name might make it sound, and it gives a lovely result. It's the kind of thing that people will use as a red carpet prepping to get that glow. You could do a course of skin peels at a clinic, or you could move on to the more classic pigment busting devices such as intense pulsed light or laser, both of which break up the pigment in the skin and help to disperse it. So those are the sort of things that are popular now for moving towards a clearer complexion. For softer skin, it's really all about hydration. It's about cramming extra moisture into the skin in one way or another, and you could do that topically with great skincare. You could try the kind of facial, like an intraceuticals facial, which infuses a hydrating serum into the skin under oxygen pressure. Or what's really popular at the moment are the kind of injectable moisture jabs that involve tiny injections, really tiny injections, to place a film of hyaluronic acid gel just under the surface of the skin. And in there, it can hang on to moisture, and it has what's called a bio-remodeling effect on the skin. It's a biostimulator. So rather than just sitting there and hydrating, it is actually encouraging your skin to renew itself from the inside out. And that also has a knock-on tightening effect, though I still think of it mostly for hydration and skin smoothing. Fewer wrinkles. We all notice wrinkles when they start to set in. We all want fewer of them. And again, active skincare is the place to start. Skincare with the kind of ingredients that will actually support and strengthen your skin. You then have a whole raft of Tweakments that can stimulate collagen growth in the skin. Anything that creates an injury in the skin will force that kind of wound healing response. So whether you're driving microneedles into it or injuring it with a laser or using radio frequency, again, to boost the collagen production deep down in the skin, those things are all going to stimulate collagen. Though there are easier options. Here's me lying under a light device. It's an LED light canopy, which is, I think in that case, using near infrared light tinted yellow, so it shows up. But red light, infrared light, these things, it's the easiest thing in the world. All you do is lie down and have a little nap. But the light genuinely has a stimulating effect on collagen. The infrared goes a bit deeper, so that will stimulate bone as well. It's very soothing. And a course of light treatment is a fantastic thing to do, isn't it? And it works very well with all other things you might be doing if you're considering Tweakments. So you can have it alongside other procedures, or you can have it on their own. And practitioners who have this option often say the only difficulty with it is persuading patients that lying down for 20 minutes under a lamp twice a week really is genuinely beneficial, because they don't notice until they've done a whole course, and suddenly they find they are getting all that regeneration within their skin. And then, of course, there's Botox, which usually is the first thing we think of when we come to unwrinkling the skin. And that's there, and it's fab. In the right hands and used lightly, it's a really, really useful tool. And people are still scared of it, largely because of the way the British media jumped all over it 20 years ago and decided it was a deadly poison and only idiot, vain women were trying it, and how stupid could you be? And that perception has unfortunately stuck around for much longer than it needs to. Botox is a prescription medication. It's very well proven. It's one of the few things that can be used time and time again to do the same job, and your muscles regain their function every time. But I'm not here to advertise Botox. I'm just saying it's down the bottom of the list because it's an obvious thing, it is there, but there are other things you can do for wrinkling. When it comes to brighter eyes, we all need more sleep, we all need a good lifestyle, we all need less stress. All these things have an impact on how we look. But apart from that, again, active skincare. I'm not a great one for eye creams, but IS Clinical has a fantastic eye cream, which I've had so widely recommended. I feel I need to pass on this bit of knowledge to you. Facials Plus, again, those can all help tightening up the skin, lifting the way we look. And there's also that element of taking a bit of time out, having a bit of a lie down. It can just make your face feel that bit better. In a more direct mode of action, we could have laser skin tightening or radio frequency skin tightening, which can be done really quite close up around the eye, just opening that area up. Because the trouble is in the eye area, you know, as we get older, we're not just losing fat pads from our faces, but the bone mass is reducing as well inside our skulls. So we start off with nice small eye sockets when we're younger, and these expand into great big hollows as we get older. So you have got a problem there. And the easiest way, well, it's true, unfortunately, you know, you need a good concealer. It is your friend. But under eye filler for hollowness it can work very nicely. It can also be horrible. You just need a great practitioner and good products, and it can give a good result. But eye hollows are just something we all have to deal with, and it's a fact of life as you get older. Less sagging in the skin. We all tend not to notice sagging in the skin until it has actually happened. And then we will all go into a practitioner like Sharina and say, all I want is this tiny little movement to counteract sagging. But in fact, there are so many elements that have led to that skin sagging, because there's the loss of the fat pads in the face, there's the loss of bone, the skull shrinking and the eye sockets getting bigger. And then there's the collagen breaking down in your skin so that it becomes slacker, so the wrinkling is more obvious, and you've got this looser skin draped over a shrunken frame. So by the time all that's happening, sorry, not to put too much of a downer on things, it's quite challenging. But again, start with skincare, because you want your skin to be in brilliant health, whatever you're doing. You know, then maybe try some facials plus, or the lighter side of radio frequency skin tightening, which is good, or more aggressive forms of radio frequency that go a bit deeper. There are forms of radio frequency where you shove the radio frequency in through needles, so it goes deeper into the skin, produces more of a result, or ultrasound skin tightening, which can lift as well as tighten the skin. And then there's fillers, which is the obvious thing to do. And fillers done well, you know, you can get a lovely result. I find now mostly people are more scared of fillers than they are of Botox, which certainly wasn't the case 10 years ago. And I think that's just because we have seen what happens when it goes wrong, and it can be very obvious, but done nicely, done subtly, done thoughtfully by somebody who really understands the proportions of beauty, the face, what's beautiful in the face, and how your particular face might benefit from these things. You know, they can be really fab. And also, so there's filler for revolumizing, which is propping up the cheeks, just boosting the lips a bit, putting back volume in the temples where that has started to fall away. But then there's also the structural use of filler. Our jaws shrink as we get older as well. So we lose height from the jaw. So that means that whereas your jaw would have been down here, sorry, at a nice angle, it will be up there. So replacing a bit of filler underneath the jaw can sharpen up that angle nicely. In fact, I think I should be on the next slide for that, because, sorry, have I now? There. Particularly with the jawline. This is me last year, before and after jawline filler. I had a milliliter of filler in the point of the jaw, and also quite a bit in the chin and some in the temples. So then you've got a kind of 3-vector pulling up this way, back that way, and forward. And that just, as you can see, gives me back a jawline which I didn't realize I hadn't got. But also after the treatment, I did this story as a piece for the Times, because it was having an awful lot of filler all over my face in one go. And they said, oh, how scary. But then they took before and after pictures where I looked almost identical in the before and afters. And people said, oh, you know, all that filler, all that expense, what was that about? But what they didn't show were these pictures from the side where you can see what it's done for my profile. And also the cheek has moved very slightly up and back, so the nose to mouth lines. Anyway, it can be great. But for the jawline, if you've got jowling under the jaw, then there are ways of tackling that. You can have fat-busting injections. You could try cool sculpting, which is fat freezing, or you've got Sculpture here, haven't you? They've got a jaw option as well. That actually destroys some of the fat cells in the area, so what you get rid of is actually gone. Or you can use, do a jawline filler, can help jowling by redefining that area. It takes away attention from what's underneath. Or again, tightening the skin with energy treatments. You know, ultrasound is quite popular for tightening the lower face down and into the neck, and it all just picks up that bit, makes it more helpful. So where to start? In theory, I'd say always start with skincare, then move on to facials plus, and then consider treatments, you know, in that order, because you want to get your skin in great shape before you even start. In practice, there's my book. There's a consultation is the first place to start with a brilliant practitioner, and you all know where to find a brilliant practitioner. Sharina and her team, you know, are adept at all these procedures. And what you really want is a treatment plan. You know, I'm not the person to say this, but you shouldn't go around doctor hopping from place to place. I mean, because of my career and writing about different things, I tend to have had a rather piecemeal approach to, ooh, I wonder what so-and-so could do with my lips, or this person's doing great stuff in the temples. So I end up with a bit of a jigsaw of a face and have to let it all fall back into place every now and again. But get a treatment plan, because that will enable you to see what needs doing in your face, and balance up, you know, as you were saying earlier, what the patient wants with what would be good, and then what's possible and what's within budget. So there are a lot of things to consider. But if you have a sensible treatment plan, then you can see how you might move from the start of it onwards at a pace that would be comfortable for you. And then explore, you know, here you've got fantastic brands of technology out here. You can go and see what they do. You can get an idea of how they actually work, see what results you could get, how to find out what to ask your practitioner and all the rest. There's a lot on my website. And so back to what I think we want. I think we want that fresher looking face. There's an awful lot of ways you can get it. And it's all about making small changes that add up into something that you will feel happy about seeing in the mirror. So when we look in the mirror in the morning, you get that, oh, not so bad feeling, which I think is really what we're all after. So thank you very much.
A lot of the negative press has happened from 20 years ago that has remained until this time.
It's the awful thing, isn't it?
It is.
It's still there, these entrenched attitudes.
Yes.
And because the other thing I find, sorry, I'll just stand up.
Please.
The other thing I find out about this, because going back over my cuttings books, I realised that a lot of the themes that I've written about, they're just the same themes now as they were then, which is there in 2002, I confidently wrote a piece saying goodbye to the cosmetic cowboys. I think, well, what was this? And it was the launch of the British Association of Cosmetic Doctors,
wow,
which is now BCAM. But thought we'd solved that problem all that way back. We so haven't. The other things the commissioning editors always want, they want how to get a perfect bottom. Has she or hasn't she in terms of film stars?
Yes.
Goodness, men have treatments too. These things come back every 3 or 4 years. I've written the same thing over and over again.
Over and over, yes.
Which makes me despair. You think that aesthetics has evolved so much, and the media's take on it really hasn't. So it's quite distressing to still be writing the same things about, oh, it's so scary, should I do this?
But I think what you've done by creating the book, creating the website, it makes an audience, a consumer, a potential patient have so much more information before they go on board with that journey as well.
Thank you, because education is just
key.
Absolutely, you know,
Yes.
just there is so much material out there. Just find out about anything you're curious about, and then it makes it all easier.
Thank you for my time.